Now, the debate around reopening our schools is something of a prickly pear. The Minister of Basic Education is consulting widely, not wildly, and considering the guidelines of the World Health Organization that schools should actually be closed while infections are rising rapidly. But there is no perfect answer here. There are strong arguments for and against schools reopening. We expect the Minister to make a decision on the matter sometime over the weekend. Uppermost for those who believe schools should remain closed is the health and well-being of our children. Well, let's discuss that now with the South African Paediatric Association. That's a professional society representing paediatricians in the public and private sector in the country. They believe schools must reopen. And I'm joined by Professor Mignon Makalich. Good evening, Prof. Thanks very much for your time. Now, some would say any risk, even a low one, is not worth it. Why does SAPA believe it's a risk worth taking to reopen schools?
Thank you very much for having me on your show. And I completely agree. This is a very anxiety-provoking time for everybody. And as a scientific organization, we are monitoring the available research all the time. And current predictions show that children under 19 have a very low risk of death, something in the region of about 1 in 76,000. So that's 0.001%. And you may say that one death is one death that you don't want. And so we are saying that if you have a responsible adult carer at home, that is somebody who's not under the influence of drugs or alcohol, who can provide education, psychological support, safety, and nutrition, it should remain the parent's choice to keep children at home if they can offer them that. But we know in reality that many of the children in our country just do not have that available. And so apart from education, we know that in South Africa, 2.5 million children have experienced hunger. And that is before the whole lockdown. And we know that many schools provide school meals, a cup of soup, a sandwich. And as parents have lost their income, we know that this is going to be a bigger problem.
Yeah.
We're also very worried about the psychological effects on kids. And we've seen that in Hubei, in central China, they had depression in a quarter of their 8 to 12-year-old children. And so kids find this very anxiety-provoking to be stuck at home, not to see their friends, not to interact with their teachers.
So,
on top of that,
I'm just going to make that last point because I've got a few questions that I want to ask you.
Yeah, sure. I was just going to say the other thing, as a pediatrician that works in Cape Town, we've seen really an enormous amount of trauma and child abuse because children are being left at home. And so if you've got a closed school but an open economy system, you've got probably in the region of about 2 million children in South Africa under the age of 15 who do not have a caregiver because they've had to go to work.
And you know, those are all excellent arguments, all excellent points. The reality is the World Health Organization is advising against opening schools if infection rates are going up. Are you saying the World Health Organization is incorrect or not considering perhaps special circumstances here in South Africa?
Yeah, so I think we're going to say that you need to consider special circumstances. And as I've said, if you're in an environment where you can provide safety for your child at home, we're saying that should be a parent's right. If your school is not a safe environment, so if you don't have any running water or any hand sanitizer, you may want to address those issues. And this is a great time for public health to really step in and assist schools in becoming safe places for children when their parents go back to work. Because we've seen level 3 lockdown now, parents are going back to work in taxis, but the kids are staying at home. And we're saying under those circumstances, it really is much safer for kids to go back to school, to get a meal, to see their friends, not to have the depression, but most importantly, not to get shot at, not to get have child abuse and all the kind of terrible trauma that we see. Kids being run over because they're running around in the streets. Kids going to shopping malls with their parents. So, you know, we've all seen that. And so we're saying in a contained environment where schools are safe and we try and make attempts to keep schools safe, we think overall the benefits of getting kids out of homes that are not supervised into a school environment is far better than
Now,
closing all
you
doors.
say you've looked at all the science, and I think quite a lot of research has been done into children and COVID-19, but we know science is evolving and we're learning new things about this virus every single day. But you yourselves admit there's very little data about COVID-19 and children in poorer countries, such as ours. So my question then is, what about children who are immunocompromised, who've got HIV, who've got TB? Surely that's something that should really, I would imagine as paediatricians, that has been absolutely considered. And if so, what is your feeling?
So you're absolutely right. We have looked very carefully at that. And ironically, many of the children with immunosuppression, transplants, oncology patients, children on steroids, have not seemed to have acquired this condition, which we were surprised about. But if any parent is concerned about that, the best thing to do is to speak to their pediatrician, their GP, their clinic, and find out what the risk is for each individual child. But on the whole, there's so many more children that are normal, that have normal immune systems. Even if they have mild asthma, even that is not a contraindication to trying to get them back to school. Kids must wear masks, they must keep their hands clean, and they should be sitting not on top of each other. And this is something that you can teach even at home. You can try and reduce the anxiety in your kids. The whole family wears a mask. Everybody learns from each other. And if you see Japan, Korea, the mask-wearing countries, it becomes a norm where people actually, kids love copycatting their parents. So if you've got a funky mask, that's the right thing to do. It is the parents' choice at the end of the day, but we want parents to be informed, and we're very concerned about the safety of the majority of the poorer kids in our country in terms of hunger, in terms of psychological safety, but also in terms of physical safety.